So our next speaker is Dr. Amy Hogan, who is a good buddy of mine as well. And she is a general practitioner here in town who specializes in fertility care. She and I work together. I teach women how to chart the cycles, and if we find some problems, then she can help with diagnosis and treatment of possible fertility issues. She also sees just regular old patients too, not just fertility, but that's where her heart is and her passion and her skill for sure. But she's going to talk a little bit about how hormones can cause problems. You think that's hormones? Yeah, everybody say yeah, they're horrible, but they can also help. Yeah, that's the thing, is that's what I learned from her, is that we hate on ourselves so much for these hormones that we really don't have tons of control over. But really, there are hormones that protect. And so, but she'll talk about how that can create some inflammation problems and what we can do about it. Dr. Amy Hogan.
Well, I have to say that I'm definitely jealous of Dr. Monica's slideshow, but I'm definitely a little bit more jealous of Dr. Maria, because first of all, she's so beautiful. But second of all, my son, Benjamin, worked here during the summer for about 2 months. I spent 17 years raising the kid, and everyone likes to ask the doctor, do your kids want to be doctors too? And I'm like, probably not. He worked for Dr. Maria for 2 months and wants to be a chiropractor. And Dr. Jeff is probably Dr. Jeff's. I think they got along. They're a little bit the same kind of mold. So what I'm going to do today is talk about the hormone balance, because, and a lot of you ladies, I see some nice brown and blonde hair, but I also see some gray hair. And so what I've got is I've got a hormone symptoms list. I like checklists. I don't know about you guys, but something to kind of check and see, how do I feel? And so you can take it home. You don't have to do it tonight, but it's something that you can look at and assess yourself. How's my hormone balance? And what I do a lot of is trying to not just understand the cycle, but also get it balanced. And when you do that, every part of the woman's health is better. The breast health, the uterine health, the mental health. I think all of us know as women that our hormones are hardwired into our brains. And I don't have to convince anyone. Everyone's like, So what I see a lot of times is getting to understand the cycle. People then understand themselves. They get themselves a little bit of, I understand why I felt this way when my cycle was changing, and give themselves a little bit of credit for the changes that they feel through the month. And then also, I liken premenopause and menopause, when you're starting to make the change backwards. We all know what kind of puberty was like, and I'm always thankful I don't have to go backwards. But the other thing happens when we get to the end of our cycling time is we go through premenopause. And I think that premenopause disjuncture actually is part of the risk for breast cancer. Let me explain. So as we are going through life, we're making a lot of estrogen. It goes up and down, up and down. At this period, as Dr. Monica was explaining, you're the lowest you'll be in your month. That's why right after the period is the best time to check for your breast exam, because all the hormones are low. They're about to climb the mountain again. So the estrogen goes up for ovulation, comes down. After ovulation is when progesterone and estrogen play together. But the balance is so important. So as you mature into premenopause and you have less ovulations, you have less progesterone. I always call estrogen the busy high school hormone. It says be active, be fruitful, be on the go, and grow me something. So my little girl who's 10, call her my woman child, is changing. And starting to have changes where she's looking more like a woman little by little. You all know that, how that happens. But that's the estrogen. Estrogen grows something, okay? So when we talk about yes, hormones are bad, the problem is hormones themselves aren't bad, it's the balance that goes off. So in my little girl, her having estrogen dominance for a few years is normal, because that's gonna grow the hips, and that's gonna grow the breasts like we're talking about. But if a girl is estrogen dominant for a very long time, in other words, doesn't ovulate regularly, she will have higher risk of breast cancer. So girls who have polycystic ovaries where they go 3 months between periods, if you go 3 months between periods, it means you went 3 months without ovulation. And what we found over time is healthy women ovulate. And so some people call the menstrual cycle the 6th vital sign. Like you got your blood pressure and your heart rate and your pulse and your respiratory rate, everything else. But that's actually so important to women. one of my friends named Marguerite Duane is trying to go all around the U.S. talking to medical schools about getting more cycle medicine into the medical schools. Because I'll tell you that I learned more, if anyone is still cycling or have younger relatives, women who are cycling, get in with Dr. Maria's class. Because what that gives you is a wealth of information, a wealth of knowledge, so that you know what's normal and what's not normal. Unfortunately, most people don't know what's normal to themselves until they start to get cycle charting and understanding it. So again, progressing to premenopause, why is this a risk for breast cancer? Because we're gonna naturally ovulate less often, just the way we are. The body, I always compare it to that the ovaries are getting to a place where they've got kind of a long career. They've got a lot of time off though. They've built up some time off. So some days they'll come to work and they're doing their job, they're doing their right thing. Well, but you know what? The next day they're tired, they're gonna stay home. So in premenopause, we have a lot more swings of hormone and they're a lot more up and down with a little bit of almost radical vengeance. And we feel it too. Our moods will be a little bit different and the way we feel from day to day changes. And so again, as we get into premenopause, we're getting more estrogen dominant, okay? So you may drop an ovulation. Oh, that was 40 days between the next cycle, one cycle to the next. Oh, wow, 50 days, 60 days. And so what you can say is the ovaries are still active, they're still making some estrogen, but you wouldn't have ovulated for that progesterone balance to come in and say, stay put, get a job. So I call progesterone the college or get a job hormone. Relax, do your job, stay put, like Dr. Loader, right? He's gonna come and stay put. So we want that settled. We want to be able to say, okay, cells, you have a purpose, do your job, stay put, relax. And so in that time, that magical time of cycling, when you actually have the estrogen and progesterone playing together, that might actually, let's say you did have a pregnancy happen, the progesterone and estrogen are going to keep paralleling upward, keep the pregnancy in place, okay? But if you always have low progesterone, like a lot of the girls that I work with cycle lows or cycle problems, this one you always have low progesterone compared to estrogen, it does put you into a natural, unfortunate, higher risk of the breast cancers, okay? So keeping that balance is part of the anti-inflammation. Also part of this is testosterone. So women have testosterone too, and that testosterone balance is also important. You're like, what? Testosterone matters to me? Yes, it does. A lot of things, energy, libido, mood, stamina, muscle tone, right? But also the stroma of the breast cell. What's a stroma? So we think about the cells looking like little grapes or little sacs and little round bunches. But the stroma or the tissue or the netting that it has to set in also has a particular importance. And so some people will tell you that the testosterone helps to keep those tissues stronger and therefore they have more support. So testosterone is not just for men, it's also for women. And in the premenopause state, it's not always easy to balance it, although there are times when we can do some things with the adrenal glands to help it calm down if they're just way too high. But in premenopause and menopause, when the ovaries start to check out, guess what also checks out? The testosterone. So women are like, why do I have lower libido? Because women, we hear a lot of commercials on TV about men going low T. To your doctor about low T testosterone. Low T, low T. But the thing is that almost every woman will go through low T, but nobody's talking about it. So once the ovaries are done, the ovaries make your testosterone also. If they're not coming to work as often, you also won't have that ability, or you won't be able to keep the same energy, libido, mood, and stamina. Okay, so we checked that too, and most of my girls in premenopause, menopause, natural testosterone. Does anyone know the normal testosterone for women? Like, what's the usual range? If I was to check your lab, because that's what I do first things, is I check people's lab. I check the estradiol, progesterone, testosterone, DHEA, which is a adrenal support hormone. But testosterone for women is 20s to 40s, okay? So kind of in a little zone. So think about that. Now guess what men are? From puberty to death. Anybody? Guesses? No, but everyone's scared of me. So if you want to make a grown man blush, I'll just stop for a second because this weekend I was talking to my kids online. I have 2 kids in college, one of the ones who wants to be a chiropractor now. And if you want to make them blush, tell them you're going to do a breast health extravaganza for Dr. Maria. So anyway, men's testosterone, no guesses, 300 to 1,000 from puberty to death. People always say, oh, it must be double. No! 10 times! So there's a reason why they get their muscles at 15 and don't deserve it. There's a reason that their energy level is totally different and they like to play different sports. That's normal. And I like to say that that's good normal. It's just that we don't always give it the credit where the credit is due. But when we replace testosterone even in women, we're not looking to make them into a man or grow chin hair. We just want them to have their normal balance back. So that's why I think that natural hormone replacement, so I don't always want everyone to go on hormones, no. But getting it right makes that much difference. It makes that much difference to how they feel. It makes that much difference to how they look. It makes that much difference to their energy. Yes, ma'am.
So what I'm hearing you saying, and I'm not sure I'm understanding, but like muscle loss, can that be because you've lost testosterone?
Absolutely.
Oh, what's your phone number?
So it does matter, and yeah, we spend a lot of time, invested in women to try to get the right balance, the right fit, and it's not a one-size-fits-all. That's also why a lot of American medicine has gone, because you have doctors that, and I'm one of them, that is like, okay, let's get you a pill for that. And it just doesn't do us justice. And so what we do that's also part of the gig is get the right fit for the right woman at the right time. And so from cycle health to premenopause to actual full menopause, it absolutely matters in trying to get it just balanced. Now the last hormone I talk about is DHEA. It's adrenal support hormone. So it's an adrenal support hormone that also supports ovarian function if you have any left. But it is a little bit androgen-like. It does a lot of what testosterone does, but less potently, a little weaker, a little gentler. So DHEA again comes from the adrenal glands, and we find it in my back because adrenals are right on top of your kidneys. People always think their kidneys are like way down here, but they're really up here. And so the adrenals are about up in the upper back, and they're supporting us through life of stress. Like nobody has stress, right? So cortisol, epinephrine, adrenaline, you've heard of those, but DHEA is a little known adrenal support hormone, but it also would support breast health and vaginal health. And how would it do that? In a cycling woman, it would help support her natural estradiol and testosterone to be normal, okay? So if a cycling woman doesn't have enough DHEA, you check that to make sure that that's supported and that her ovarian function is supported under stress. Women who don't have enough DHEA, I've found it to be that paramount to even pregnancy. I'm not going all over the map here, but again, it's a whole continuum. And so if a girl is low in DHEA and she can't get pregnant, replacing it is that important. It may mean the difference between not having any children or having children that have, low birth weight to having, many children that she wishes. So it's a beautiful support hormone that does a great job for us. And helps us out. Other things that it would do, like in premenopause, menopause, I tried it on myself, energy, libido, mood, and stamina. It's great for all of those things. Again, supporting the actual balance. I call it the little helper hormone, the little prince. If testosterone's the king, DHEA is kind of the little prince. I can get under you, I can help you out, I can give you a little bit of support while we're in this change. And sometimes DHEA is helpful for premenopause even more than menopause, although those girls like it too. So,
Question. DHEA, I have been told that supplementing with DHEA increases your chance of breast cancer. Can you speak to that?
If you are non-discretionary, like if you never looked at it, like if you said, I'm just going to take DHEA, I'm not going to see if I'm balanced at all, you could heighten your own estrogen if you were not keeping it in balance. Okay? But it is not necessarily, a lot of times when people are selling it on the market, for example, they'll say it's a non-estrogen. It's not going to, it doesn't raise your estrogen load directly. What they didn't say is there are some products also for vaginal health where they'll actually, insert a suppository of DHEA. It makes that tissue make some estrogen. Okay, So I would not say it causes, but I would say you want to be thoughtful. Don't just go grab it and say, I'm going to take 50 milligrams. I start my girls on about 2.5 milligrams. And a lot of the over-the-counter products start at 20, 25, 50. And it'll throw your level way up to the sky, and that might not be good.
Okay.
So, yeah, good question. So, again, I guess my take-home point is, are estrogens bad? No. Are progesterones bad? No. Are testosterone bad? No. Is DHA bad? I think all hormones are good, but what we want to see is the perfect fit and the perfect balance. And so, if we can support the woman and get her to that normal zone, help her to be as best as we can, as perfect as possible, then she'll have overall better breast health, less inflammation, and happy, healthy girl. Any questions else? Yes, ma'am.
When you're in menopause, how long should you take for the hormones?
Hormone replacement?
Yeah.
That's a great question. The PrimPro studies, so what got hormones a really bad name was there was a PrimPro study in the 1990s, and they wanted to go for 7.5 years with the Premarin and Provera. So let me also explain. All the hormones I've been talking about tonight are natural hormones. I don't want you to go grab PrimPro because that would be pregnant mare's urine estrogen. Premarin, get it? Pregnant mare's urine. And Provera, which is like Depo-Provera, which is class X in pregnancy, really shouldn't be in the human body, causes inflammation and other problems, okay? So in the PrimPro study, they found that PrimPro enhanced the risk of breast cancer and heart disease. And all of a sudden, all hormones got thrown under the bus. Well, guess what they said? Instead of saying, which their study proved, they had 181,000 women enlisted in the study. Some of them were on PrimPro alone, some of them on PrimPro, some of them on placebo, okay? They came out and said, oh, the combo hormone replacement therapy causes breast cancer. And because their study showed that at 5 years, the risk was outweighing the benefit, instead of saying PrimPro was a problem, they said, all hormones are the problem. Take them all, 5 years or less, because that's when their study showed that the risk outweighed the benefit. And so you'll still hear that in medical literature. That's why most doctors will be like, are you still on hormones? What are you doing on hormones? Because they think it's just crazy, because obviously hormones are bad and you shouldn't stay on them for more than 5 years after menopause, okay? I have some women in my hormone replacement therapy clinic that are 80s and 90s. And they're some of the healthiest ones that we know. And one of them even has her own little health blog. She's amazing. And her, you know, it's memory too. I have, again, I'm divulging way out. You need to shut me up, promos. Time's up. There's some studies about Alzheimer's now too. So hormones continue to amaze me the longer that I work with them. That they're also showing decreased inflammation for the brain, helping the brain and the neurotransmitters stay going longer. So they really do have some amazing benefits, and I think that we only know the half of it. Any other questions? Good question.
Physically in the office anymore. I've transitioned to a telehealth-based functional medicine practice. Functional medicine is really just the practice of taking lab work, maybe blood work, maybe HTMAs, which I'm going to talk a little bit about this evening, stool samples, anything like that, using that objective information and then suggesting either dietary, lifestyle, or supplement protocols to help kind of balance out the objective information that we're getting from those labs. And so minerals in particular are something that I'm really passionate about and something that is not really being talked about. And so what do I mean by minerals? I'm going to skip that one. We've already talked about it. So minerals, when I say minerals, what I really mean are what most people think of when they think of electrolytes. And they are the spark plugs in our body. They're I call it the like matchstick. It's the spark that sets off every single reaction within our body, whether it be digestion, whether it be detoxification or hormone production. And in the United States, we are chronically depleted in minerals, everyone across the board. Some of the reasons are depleted soil and the way that our farming practices have used up all of the nutrients in the soil, but also our filtered water. There's a lot of reasons why that comes up. I have to say, I give trainings in online all the time, and I've never done one under 20 minutes, so I'm like talking really quickly because I have a lot to get through and I don't want to take everybody's time. So if I'm going too fast, let me know. And then if you are of childbearing age, or if you've had children ever, the minerals within our bodies, when we're giving birth and growing a baby, we pull actually almost 10% of our own mineral stores in order to build that baby. So if we're starting on a depleted foundation of minerals and then we're moving through these pregnancies, it very quickly turns into a problem. And so why is that a problem? Well, first of all, let's talk a little bit about what the minerals do. So when I say macro minerals, we're again talking about the electrolytes. Those are calcium, magnesium, sodium, and potassium. There's a list up here of some of the really important things that each of those do. I'm not going to read them to you and make you listen to that, but they each play a huge role in our stress response, our hormone production, our digestion, our detoxification, all of the things that make our bodies run well. And within that, we want to talk about hormones, obviously. What does that have to do with breast health? So we have to kind of go back to, this is so wonderful. Dr. Hogan, I don't know if she's still here, really set me up to not have to go through some of this in depth because she did such a good job. But the ovary, adrenal, and thyroid axis, those are the three main endocrine glands in our body that control our hormone production and our hormone health. But there's obviously other ones, pancreas and pituitary and that sort of thing. But these three work in harmony to really create that hormonal balance that Dr. Hogan was talking about. And so it starts with the adrenals. And our adrenals are what responds to the stressors, the everyday stressors, all day long, chronic. That's not necessarily how our bodies are meant to live, but they're learning to adapt, and they do that with the help of sodium and potassium. Every time we have a stress response in our body, we are burning through sodium and potassium in a really big way. And when we run out of sodium potassium, which is very common and something that happens when we're chronically stressed, then we start to use our calcium and magnesium. And when we do that, we pull it from our tissues, from our bones, from the different reactions that are supposed to be happening in the body, will reallocate to that stress response. So especially, this is the example that I like to give. I have women come to me all the time saying that they've never had a cavity before, and then they had babies. And now they have so many cavities, and it's because when we pull those minerals from our body in order to have a kiddo, our teeth are included in that. Our teeth are very mineral based, and especially for my women that are postmenopausal, and we're talking about bone health and osteoporosis, it's really important to take into consideration supporting our minerals, because it's going to help make sure that we're not leaching from those places where we obviously want to keep the minerals. So then if we move on to thyroid, our thyroid requires our adrenals to be managing our stress and using the minerals that are appropriate, because when we start to pull from the calcium and the magnesium, it slows down our thyroid's ability to create the energy it's supposed to. So our thyroid is what is necessary, or our thyroid is what controls our energy production, our cellular energy, our metabolism. And calcium, when it is released in the body in free form to respond to the adrenals, is actually going to bind to the different spots in the body where thyroid hormone is supposed to bind. So it blocks your cell's ability to get that thyroid hormone into the cell and actually create the cellular energy that we're supposed to. And if we don't have cellular energy, then we're not going to ovulate. Just like Dr. Hogan talked about, a healthy body is an ovulating body. It's our 6th vital sign. And when we have a decrease in thyroid hormone and the way that it is acting on the cell, then we're going to have a downgrade of the internal environment that is necessary for ovulation to happen. If we're past ovulation, that's okay. Minerals are still very important. We still really need our adrenals and our thyroid to be working properly to be able to oppose the estrogen in our body. So we talked about the ovaries, and the ovulation is what produces our progesterone. And progesterone is what opposes our estrogen. They have to work in harmony. Just like Dr. Hogan said, they're supposed to balance each other out. And so if we're not ovulating, or even if we're ovulating and our body does not have all of the building blocks or tools that it needs in order to create and produce the progesterone to oppose that estrogen, then estrogen is going to end up running rampant. In my patients who are premenopausal, menopausal, or postmenopausal, that estrogen production does naturally start to decrease. And there, like Dr. Hogan mentioned, plenty of things that we can do to make sure that we have that progesterone and estrogen balance. But in my patients that are still ovulating, it's really important that all of these things are working together in harmony to produce the progesterone to oppose that estrogen, because when we have a situation where we don't have the estrogen to help oppose, then, progesterone oppose, the estrogen will run rampant in what we call estrogen dominance. And so estrogen dominance is a key factor when it comes to breast health, and there's quite a bit that can happen when we have high estrogen levels and they're not being opposed or supported or balanced by the other hormones that are necessary. And so a few of the things that you can see when it comes to breast health would be hypersensitive breast tissue. This may look like, if you are cycling, increased pain or swelling or tenderness during your cycle. This is also going to lead to more fibrocystic breasts. And when we have breast tissue, I think that this has been touched on, is, it's made of 3 things. We've got fat, we've got glandular tissue, and connective tissue. And the glandular and connective tissue, that's the fibrotic part. And when we have increased estrogen, that is going to, just like Dr. Hogan said, it encourages growth. We're going to have growth of the fibrotic parts. And when that gets out of hand and we have too much of that, especially at, I think the statistic here, at the time that you hit menopause, if your fibrocystic density in your breasts is over 50%, that ratio of the fibrotic parts to the fat parts is higher than 50%. That status alone can actually increase your risk of breast cancer later on by 4 to 5 times. So making sure that we are decreasing estrogen, estrogen dominance. Some estrogen is good, just like we talked about, but making sure that that's balanced and that it's supported through our nutrition and as well as our minerals is especially important. And so this is on your handout. Okay, yes, I told you I was not good at managing time.
It's very thorough and very...
And so there's a couple of, this is, like I said, on your handout. There's a few primary foods that are amazing for getting your minerals. And the one that I encourage everyone of all ages to do is something that we call an adrenal cocktail. The recipe is also on your handout. It's a combination of whole food vitamin C, potassium, and sodium, and it's going to really support those adrenals, which therefore supports that whole axis. and helps make sure that we are managing our hormone ratios. Iodine is also a really important. I was going to do a special mention of a micro mineral, and really this is important for creating thyroid hormone as well as breast development, but not just development, but breast tissue regeneration as that changes over time. Iodine is really important for the ability, especially if you have fibrocystic breasts and you start working on your health and you're really moving away from the estrogen dominance that could be creating that situation. Iodine is going to be really important in restructuring that breast tissue. But iodine is not something that I recommend you supplement without testing and without guidance by a provider. It can be something that goes a little off the rails if you try to do it on your own. And then the test that I recommend is an HTMA. It's called a hair tissue mineral analysis, where we take a sample of hair and we look at the mineral status within the cell so that we can determine what your specific individualized mineral plan is, and how your body is handling stress. It's a very useful tool for knowing if there's a particular one that may be extra helpful for you.
Thermography will look at all the skin surface temperatures in the body, and it will pick up all the areas of heat. And so why I wanted to talk about that app is when it comes to your breast, in the breast, a few years before it starts to dimple or pucker or have some situations, there's heat going on inside of there. That heat, typically it might be a couple of years. Things don't happen super fast in the body, you know, it takes a little bit of time. Thermography sees that. So it sees what's happening inside before it ever gets to be a dimple or a pucker or any of those things. So like when you get to that level, that's not the level we want to be at. We don't want to see that inverted nipple, because that means that that systemic issue is happening inside months, if not years before. Okay, and that's why I love thermography, because it's looking at the temperatures going on years and years and years before that even happens. Okay, so thermography is actually not about early detection, it's about early prevention. So we are looking for areas that are ripe within the body that are happening before anything ever becomes pathological. So is thermography new? No, it's not. Is it a fad? No, it's not. It's been around for years. It's FDA approved. If you came in through the front door, I guess you all did that. Nobody snuck in another way. There is a camera sitting out there, and as you go out, make sure you step in front of the camera. It is our thermography camera. It is a very expensive camera, very, very expensive. So it sees what's happening in the body, and this has been used for breast cancer for years, okay? Years and years and years. How does it work? Okay, it's looking for temperature differential, okay? Maybe this breast is really cool and this breast is a much hotter. Maybe they're both the same, but they're more warm. It's looking for all of those temperature differentials, and we're looking for neoangiogenesis. That's just a very scientific word for heat and differential in heat, and whether it's symmetrical or asymmetrical. You might be asking, what does thermography work for? So it does work for the breast. It also works for vascular issues. It can show where blood is flowing out from the spine. Maybe on one side it's more dominant than the other, which Dr. Maria and Dr. Loader would tell you might have to do with your gait. You're walking a little lopsided, so one of your sides of your vertebrae is a little hotter than the other.
Uneven breasts.
Uneven
See
breasts.
a lot.
Or if you went to college and you carried a backpack on this side for 4 years.
Or purse.
I just had this conversation with one of my kids, and she's just looked at me like I was stupid, like, who does that? And I'm like, well, I did. She's like, no, we don't do that. I guess that's not a thing now. I thought it was. It was when I went to school. This, if you see any other slide, and only this one. This is the one I want you to see. So, by the way, thermography is a perfect adjunctive tool for breast cancer, along with other types of imaging, MRI, ultrasound, mammograms. But if you notice here, if you go and get regular mammograms, this is the size that it will detect, okay? This is the size it will be at your first mammogram. That is a breast self-exam. You know, sometimes it's larger. So this is like what I was telling you about the app. This is what the tumor might look like under thermography. There's not a tumor there yet, but we can see an area that is ripe for the picking for something to potentially grow before it's there. So in very, very microscopic areas, because tumors and cancer need a food source. And that's what we're looking for. We are looking for blood that is rushing to the area that has a certain look to it, and a vascular pattern. So, as I mentioned, the ultimate goal is not early detection, it's prevention. You might be asking, well, how does, by the way, it's been studied, it's been around. So there's many peer-reviewed studies on thermography. Also, not all thermography is the same, okay? So if you've seen thermography somewhere else and you've seen it here, the cameras are different. And this is an example of one company's thermography, and this is an example of ours. These, I'm not going to read these to you, these are in your packet. There are some, what do you notice there? Do you see, so where it's dark or red, that's the inflammation. So this is invasive ductal carcinoma. And this was obviously not found early on. So there's a bunch of case studies in there, not just for the breast, but for skin cancer. So we have seen many, this is a situation of the spine, and then you can even see, yeah, there's probably something going on over there as well. But, so thermography works for a variety of things. Here is a situation of skin cancer. So look at this back, you know, you can't even really see anything. But this is skin cancer, that was melanoma, and this person did not live. So had it been found sooner, it would have been much better. I will tell you of situations where dermatologists can't see. I mean, not all moles and melanoma look like anything. Sometimes you can feel them and you can't see them. I've had several situations already where we cannot see it on the back. We had to go back to our imaging, back to touch and feel and find it, and then we had to send patients to the dermatologist to have things removed with a positive case of cancer. So I do think it's a great thing to go to the dermatologist, but a routine yearly thermography scan is a great idea to miss the things that a doctor might just miss when they're giving you the once over. I always recommend the full body thermography, and here's why. Sometimes people want to get a breast, which is here to here. The majority of breast situations start from here, they drain into the glands, and then they drain into the breast. And so when you start to see, this is a perfect example, root canals, even spider bites and abscesses and things all drain from the mouth into here. The good news is, it's nice to know this because there are things that can be done about this. Okay, we can help this. So instead of just looking at the body here, like we're like, oh, let's make sure my breasts are healthy. It's not just here. Okay, we have to work on this, we have to work on this, the whole body, we have to work on it all together. And thermography does let us, it gives us a map and it tells us where to start. Here's just some situations of different things. This is a breast plant situation. This past week I did 2 imaging sessions on leaking breast implants. One person's was actually had a hole in the front of her chest where she was leaking out the front, and she was actually leaking out the back. It had made a hole in the front and the back. So, and the thermography helped us. She came to me and she said, I just want you to tell me that that's what's happening. And so, and she's like, I just want someone to tell me to get them out, because she didn't want to take them out on her own. She just needed someone to say, or she needed a picture so she could see it. So this is a carpal tunnel situation. This is severe lymphatic congestion. This is fibrocystic breast, not the worst case of fibrocystic breast. If you get some leopard spots all over, that's what estrogen dominance looks like. So you can immediately see what estrogen dominance looks like from a thermography imaging. And I will tell you, just as a pretty health conscious person, my most recent imaging I did had a lot more estrogen dominance than I was comfortable with. And I do biofeedback and chiropractic and massage, and I mean, I'm kind of a junkie for all those things. It took me stepping again in front of that camera to say it was there. Everything else wasn't saying that to me. But once I saw the imaging, it was there. And so guess what? I had to go to work. Had to go to work on getting the estrogen out of the body, supporting it with good minerals and lots of other things. So
Now that mostly shows up on the inverse gray, correct? Or is it on the
it shows
rainbow
up on
also?
both.
Okay.
I mean, it
Because
just
that's what I
looks
like about this camera. See how it has the two visuals.
Yeah,
so
so
you
this
have
is-
the rainbow, which the other cameras have, but this has the inverse gray, which has so much more detail.
Yeah. So thermography, it's for everyone. Young, all the way, there isn't anyone that it's not okay for. There is no risk, no radiation, no compression, no squeezing. There are times if you have something there and you squeeze it, it can cause some undue stress on that. There is no risk to this. And so how does an exam go? So there's a little bit of a protocol in advance. You shouldn't get a massage the day before, that's going to show up. So you don't want to do things that put heat in your body. You also, the morning of, a bra. A bra is going to give you serious constriction. Even sometimes, I've even seen someone who didn't wear a bra for 24 hours still have a bra line when they came in. So that's, and we're going to talk about that even further in a second. So that's not something you want. So we try to have everything be loose and for, you know, at least 4 hours before, but also you wake up in the morning, no makeup, no things on the skin, so that we get your skin temperature smooth and even, and then that helps us to see the areas of inflammation. So you come in, you have a room with a curtain. Behind that you will disrobe and you will acclimate for about 15 minutes, letting your body heat normalize. And then we will take a series of pictures. It takes about 1 hour to do a session. I did start to say that I always recommend the full body because I've had people not do the full body and regret it. And there will be imaging that goes into a part of the body that they'll want to talk about, and that shows an issue, and the doctors can't talk about it because that wasn't part of the plan. So I hate when someone has to go back and then do another part. So I always recommend the full body because it all works together. So there is also a way to get a $150 grant to apply towards thermography. I've never had anyone not get it. Doesn't have anything to do with income levels. It's the United Breast Cancer Foundation. And so my information is in your packet. There's a flyer about it, and all of the pricing is in there. So if you're wondering how much is this, I will also tell you that if you have an AFLAC cancer policy, that it does cover some, and if you have any kind of a cancer policy, typically they will come back and cover that. So you also can get the grant and apply that towards it as well. So if you are interested in any of the grant information, I just ask that you reach out by email or phone, and I will send you a link to do that. We always wait till the first of the month. They regenerate their monies at the first of the month. So all of my clients, I have them wait, and the first of the month we submit and they come in. It usually takes a few days, so we're rolling pretty good with that as well. So what questions do you have about thermography? I probably missed something, but I'm going to try and stay quick.
I did a thermology before at a different clinic, and I just did it for the breast, but I had to put my hands in cold water, and then,
We don't do that.
okay. I was
Yeah,
just wondering how.
there's different types of ways that things are done, and our organization has decided that that doesn't support the latest technology, so we do not do that. If you've had thermography done at another company, first of all, I think anything is better than nothing to have. It will tell you, it's like looking at the radar for the weather and see what's coming. We can use, if you've done it through a Breast Thermography International company, all of those reports are still there. And I will definitely tell you, getting a baseline is what is the most important. I had someone recently that did thermography that it was her 7th time doing thermography. Had it been her first, I think the doctors would have asked her to come back sooner. But because it was her 7th was actually better than her 6th. So the 7th was better. This person has done it 7 times, and they were making progress each time towards better because they had this roadmap for the full body, so they could, and so they knew, congratulations, you're better than you were last year at this time. So like that to me is a huge congratulations to that person that they are doing. And for many people ask, what can you do with this information? So basically, when I first had my first one, which was 10 years ago, I brought it home and I knew where the inflammation was in my body. I went to work on that, and I still do that today. So this is a little bit different than like a mammogram, whereas you get pages of information and a roadmap, and you can do something about it. We do also help you with that as well. So, other questions? Okay.
My presentation, and I'll do it quick because a lot of this has to be done kind of one-on-one, but has anybody ever heard of Ruby Ribbon? One person? 2 people? Okay, well, I'll go into more about that, but if you guys, the sheet that I put in the packet is at the very last one, and so I'm not up here for an hour talking to you because I can go on and on and on. I'm just going to follow it. And if you see the thermography there, and there's a picture of a woman in her bra, and the marks that it left on her, I don't know about you guys, but I have hated bras from day one, and I started wearing them in 3rd grade. And I just, if I was at home, they were always off. As soon as I walk in the door, they're off. I found Ruby Ribbon. It's not a bra, but it does so much better a couple years ago, and I haven't worn a bra in 2 years. Exactly 2 years. It's been the best thing. But I found out recently, and I didn't know these statistics, that if you wear a bra for 12 hours a day, you are 113% higher percentage likely to get breast cancer. If you wear it for 24 hours a day, I don't know anybody who would want to wear a bra for 24 hours a day. But, you know, if you're someone who feels like you need support at night and you sleep in a bra, you know, I understand that.
Teenagers do it.
Yeah.
Teenagers sleep in, they'll
Like a
wear a bra
sports bra or
24/7.
Oh, no, regular one.
They're afraid to take them off. They don't like the feeling
Someone
of
might
falling
sneak in
out.
at night.
Yeah, so you cut those things out.
Well, my niece said that she's
I
lazy
was-
and she doesn't wanna take it off, so.
Oh my gosh.
Yeah,
I just
yeah.
can't imagine.
Yeah.
I have my relationship with bras has been terrible my whole life.
Yeah.
So, but if you are someone who wears it 24 hours a day, then you are 125% higher percentage of getting breast cancer. And if you're someone who never wears a bra, I mean, the percentage is higher. Is like it's that much higher if for someone compared to someone who doesn't wear a bra. If you're someone who doesn't wear a bra, then it's like the percentage as a man would have, and that really says something, you know, because most women do wear underwire, and that underwire, I mean, it just really impacts that lymph flow and the blood flow. And if you don't have, I mean, we have lymph nodes for a reason, and they need to be working properly. If you don't wear a bra, the collagen increases, the elasticity improves, which is crazy. Because I think, you know, mine are down here now, and I don't know if that will ever increase, but they're not really down there, but they're not up here anymore. But there has been so many people that have changed and gone to other alternatives as an underwire bra, that have seen like everything is raised up a little bit, like their nipples kind of come up a little bit, everything is not hanging down because your body's working with itself to improve and strengthen, which I think is super, super cool. But our bras, and I have figured out, because people talk about their straps falling off all the time. And that was one of my issues. And I realize it's because when you're held in a shelf, it's just pushing this up, and so your straps are gonna fall. Or it may be, your girls may be so heavy that they're pulling down, and of course that's gonna hurt your necks and shoulders, and I mean, and I know that, I know we've got a chiropractor video that we show a lot of people that where she has you press down on your girls, or lift them up, or maybe lift one up and push one down, and you can really feel that pull in there. And it's something I hadn't really thought about. And I'm also realizing as I get older and they're getting further down, that even at night, I mean, if I wake up in the morning, and I get migraines off and on if my neck's out of whack, and I think sometimes part of that may be because it's pulling, because I don't have anything supporting me at night. So if I wear something, it's just something light, but it's never I mean, it's one of ours, but one of our ruby ribbon, but it's not something that's gonna have underwire. I never want to touch underwire again. And even sports bras, because they fit so tight, sometimes those can mess with your lymph nodes and those stuff too. And I think the majority of teenage girls wear sports bras, don't they? And then a lot of women who just don't want to be in a regular bra. She's got her purse in there. She's going to bring these in. But that was the main thing I wanted to cover before. And they have been around for, about, got them all organized from small to big, and I don't normally do that. So proud of myself. But we don't have underwire. It's 360-degree compression, so it holds things in this way instead of just lifting them up. Or my straps haven't fallen for 2 years. And I'm just gonna flash, I don't know if you care. This is what they look like on. I am a double D. This is a little smaller, but I'm up here. I'm up where I need to be. And they just hold everything in. It's considered shapewear, but it's comfortable. I feel like my girls are running free because there's nothing that's just like squeezing them. We can virtually fit if we start out with measurements. Sorry, like I said, I can just.
So they don't feel like Spanx.
But no, and I don't even know what Spanx feels like because I've never put them on. But I don't have a desire to put them on.
Spanx is not free flowing.
No. And that's something I was wondering too, as far as if you did thermography on someone who has been wearing Spanx. Have you ever done that?
No.
I'm just wondering what it looks like. You know, because it's not going to be just right here.
Yeah.
But it's going to be so tight everywhere that it can't be good for you.
Sure.
But the first thing we do is we take measurements, and that's something that you can do at home and send me. I've got a little form, a little link to a form I can send you, and you can fill it out and send it to me, and I can recommend styles. We have time tonight. I don't have to be anywhere. I live in Wichita, so I don't live here, but we can stay as late as we need. Danelle said that, you know, if you guys want to try stuff on and check it out, totally fine. That's why I brought stuff. If you don't want to and you just want to do it over online or whatever, we can totally do that too. But that's the first thing we always do, because 80% of women are in the wrong size bra. And I was for a long time before somebody said, "You're not a C cup." You know, I'm like, oh, well, I am on this side, but that side I wasn't. So it was really hard for me to find bras. And that's another thing too, is it doesn't have, here, I'll just pull one out. We've got all different kinds of sizes and styles and stuff that are made for different women. In this color pretty. So we've got all kinds of fun stuff too. But everything has a little bit of area there for you to fill. We can fit a size 28A up to like, we go up to size 50, but I've seen women who were like a 54, 56 anchor, that had very large boobs, breasts, girls, whatever, that it fits. So it molds and shapes to you. The cups can stretch, the camis stretch. We have demis, we have shorter ones like this. If you don't want the cami, I'm a cami girl because I like that smoothing and that shaping and that support all the way down. But they will mold to you. These cups will stretch out, and the more you wear it, the more you wash it, you can manually stretch it, and they will mold and shape to you.
The nice thing is uniform.
Yes.
So you're not pinching in one area over the other.
Yes.
Yeah.
Yeah. And they have silicone grippers on the bottom, so they stay put. I wear it against my skin, and then pull my pants up over it, my undies and my pants over it, and it stays put all day long. If I sit down, it doesn't usually move, and it just feels good. It's so good on your back. I feel a little pressure on my back, which feels amazing if you're standing all day or if you're sitting all day. And they just hold everything in place, and they just feel good, and it takes the weight off your neck and shoulders. It's not pulling down. Your straps stay put. And we have all kinds of other things too. We have undies, and we have leggings, and we have pants. We have all different kinds of shapewear, but it's all made to be comfortable. It's not made to be squeezy, and it's something I wear this until I go to bed at midnight. I don't go home and go, I'm taking this thing off. Sometimes I sleep in it. So I will stop talking.
So you have a choice of trying something.
So lymphedema, for those of you who don't know, that's a condition where you have chronic swelling in at least one limb. So this is a lifelong condition, and it can cause secondary issues like skin issues, infections, things like that. Many things can bring it on. Cancer is a big one. Also, there's some that are just hereditary, and a lot of people don't know, and they have no swelling at all until they're 35, 40, and then all of a sudden it just comes. So I do the lymphatic massage, and that's just a special, gentle kind of massage, where you're just really stretching the skin as much as possible to try to get fluid out of the affected limb. So you're doing different like stretching techniques, but you're moving it like in a certain direction and creating different pathways. So that's especially important if you had nodes removed from cancer or some other surgery or a super traumatic injury. Then you have to like create a new pathway for all that fluid to go, because otherwise a lot of times it doesn't work itself out. So you have to help it get to a different place. So that's really helpful. In general, lymphatic massages, as we've kind of been like talking throughout, are very helpful just to get all that lymph moving for different reasons, bra, tight clothing, all sorts of stuff. But another part of the lymphatic therapy is I do like complete decongestion. So it's not just the massages, it's not just bandaging, it's all that together. We do a massage, bandage with a special multi-layer compression bandaging. So it does make your leg or arm even bigger for the time being, but it's totally worth it. People reduce in size a whole heck of a lot. And the program that I have, and I'm trying to get people on board with, is coming like 4 to 5 days a week, which is a lot and it's very demanding. But it's only for 2 weeks, and then it tapers off. But that way we can get them in like every day. We're doing those pathways, doing that moving of fluid, and then rebandaging. And just from the first day to the second, the amount of difference you see in the fluid that you've lost after you take off those bandages is like amazing. It's my absolute favorite part. So, and then on top of that, those are the 2 main parts, and then we do like education, skincare, some exercises if necessary, just do a whole kind of shebang. And so we kind of taper off after that, and once you kind of hit the lowest circumference of your limb, then we'll order custom garments for you that you will then use after in like a maintenance phase. So you really don't see me for that long, but you see me like every day for a while. So, but after that you kind of maintain by yourself. and we'll do just follow-ups here and there. So it's a very helpful service for people, and lots of people have been living with this for 10, 20 years. I've heard a couple people tell me that they got surgery and had nodes removed like 10, 20 years ago, and whether the doctors just weren't quite as informed about lymphedema back then, or there just wasn't anybody around here in Salina. People were just kind of stuck with it, or maybe even, one girl even told me that the doctor told her that there's nothing that she can do about it. So, it's best to catch it as early on as possible, obviously, because it is a protein-rich fluid, so it can harden up, and then we have to do like, literally like melt it like butter, like squeeze it so hard, but, until we can move out the fluid, but, so.
Did you want to speak about insurance?
Yeah, so right now we accept Blue Cross Blue Shield. We're trying to get all insurances, but turns out they take a while to do that. So yeah, right now we have Blue Cross Blue Shield. I think our next one coming up is gonna be Medicaid. Medicare's a little bit down the line, it takes quite a while, but we're hoping to have all of them by like the beginning of next year, or almost all of them anyway.
So you're saying Blue Cross Blue Shield will cover your service?
If you have a doctor
Completely.
written yeah,
Right.
doctor written.
So, insurance will cover the sessions, but, except for like a copay or something. But, insurance does not cover the compression bandaging, which is a one-time buy, but it's still an out-of-pocket buy. And they will not, unfortunately, cover compression garments. Not that anybody cares, but there is an act going on right now, going through the House trying to get Medicare or all insurances to cover compression garments, but that's not successful yet. So, yes, it covers the like day-to-day sessions, but not the compression bandages and not the compression garments. But custom really is best. That's going to give you the best results throughout
And that's
life.
good news. It's good news because that's super healthy for the body. Lymphatics
Mhm.
are just, yeah. So
And
the
it's-
fact that
I
insurance
know,
will
I'm
work.
living with it.
Okay. It's really good. Also, if anybody is not diagnosed with lymphedema, but they have like a venous insufficiency, compression's really good for that too. So, just FYI.
So what's the cost?
So it depends what you have going on. So like the bandage kit for an arm, I wanna say it's like $75, I think, and that comes with 2 sets. So you have one to wear, one to wash, since it's like every day, we're changing back and forth, back and forth. And then for the knee down is $120, and for a full leg, one something else.
So they can just reach out to you.
Yes,
Yeah,
totally.
she can let you know.
Yes. I am open for any questions, and I can give anybody's my email directly so they can ask me whatever questions they have. But yeah, I'm just really excited to bring this to Salina because I've heard that it's really needed, and it makes me kind of sad, all the people who have not been able to get those services, so.